You probably looked at hundreds, maybe even thousands of ECGs. You see that familiar wave, P, QRS, T, and you just move on. But what if I told you the most critical part of that entire tracing is the part you're probably ignoring? Yeah, that flat line, that moment of silence. It holds a life or death secret. In the next few minutes, we're going to decode what's really happening in that pause, and I promise you will never look at an ECG the same way again. Ready? Let's dive in.
Okay, so look at this. You see that first little bump, right? We all know that's the P wave. But then, nothing. A perfectly flat isoelectric line. Your first thought might be, uh-oh, did the heart stop? Is the machine broken? But the answer is a huge no. In fact, this little pause is one of the most brilliant and essential designs in the entire human body. Let's break down exactly what's happening, piece by piece.
So to understand the pause, we have to start at the very beginning. Where does a heartbeat even come from? Well, it all kicks off with a tiny spark from a special group of cells way up in the right atrium. You can see it highlighted right there. This is the sinoatrial node, or the SA node for short. I want you to think of the SA node as the boss of the heart. It's the natural pacemaker, and it decides exactly when to fire off an electrical signal. That signal then spreads out across both atria, kind of like the ripples when you drop a stone in a pond. So how does that electrical ripple actually show up on our ECG? Well, that wave of electricity is called depolarization. It's basically the message telling the heart muscle to squeeze. Our ECG electrodes, they're like little cameras watching all this electrical action. And as you can see in the drawing, the wave is moving from the top right of the heart down towards the bottom left. Now, if that wave is moving towards one of our cameras, the positive electrode, the machine draws an upward bump. And boom, that's your P wave. It's just the beautiful, simple electrical signature of your atria contracting.
Okay, so the boss has shouted the order, the atria have squeezed, and we have our P wave. Simple, right? But now we get to our big mystery. The ECG line goes totally flat. For a second, it looks like all electrical activity has just stopped. This silent flat line is what we call the PR segment. So why? Why is it silent? And more importantly, what incredible life-saving event is happening during this little pause?
So the first clue to solving this mystery is actually pretty simple physics. That electrical signal has now traveled down to another tiny but super important structure called the atrioventricular node, or AV node. And the key word here is tiny. This thing is so small and the electrical current passing through it is so weak that our electrodes on the skin just can't see it. It's like trying to hear someone whisper from across a huge, loud concert hall. The ECG machine basically hears nothing, so it draws a flat line. But that's only half the story.
And here it is, the real reason, the genius behind the silence. The AV node isn't just a wire, it's an intelligent gatekeeper. It doesn't just pass the signal along, it intentionally slows it down, holding on to it for about 1/10 of a second. Why would it do that? Well, this delay is absolutely crucial. It gives the atria, the top chambers, just enough time to finish their squeeze and get all that blood down into the ventricles, the main pumps. Without this pause, the atria and ventricles would try to contract at the same time. It would be total chaos. This pause makes sure the ventricles are perfectly full before they give that big, powerful push to the rest of the body. It's brilliant.
All right, to make sure you never, ever forget this, let's use a simple story. Think of a busy restaurant. The SA node, our boss, is an impatient customer. He bangs his fist on the table and yells, "I want a contraction." That shout is our P wave. The AV node is the super calm professional server. Does he panic? No. He calmly takes the order, and then he waits. This little pause is our AV node delay. And why is he waiting? Because the ventricles, our kitchen staff, need a second to get ready for that big order. The server just waits until the kitchen is ready before he sends the order back.
Now, quick exam alert, because this is a classic mistake students make. You're going to hear two terms, PR segment and PR interval, and they are not the same thing. Look closely here. The PR segment is only that flat line. It's just the delay time, the server waiting. The PR interval, on the other hand, starts at the very beginning of the P wave and includes that flat line. It measures the entire journey, from the customer shouting to the moment the kitchen starts cooking. So remember, segment is just the pause, interval is the whole story. So how long should this all take? In our restaurant, what's a normal wait time? Well, a normal PR interval is between 0.12 and 0.20 seconds. On the ECG paper, that's about 3 to 5 of those tiny little squares. But what if the timing's off? If it's too long, more than 0.20 seconds, it means our server is taking a long coffee break. The signal is delayed too much. We call that an AV block. And what if it's too short, less than 0.12 seconds? Well, that means the server rushed the order to the kitchen before it was ready. We see that in conditions called pre-excitation syndromes.
Let's actually see what this looks like on a real ECG. On the left, we've got a normal rhythm. If you count the little squares in that PR interval, you'll see there are about 4 of them, which is 0.16 seconds. Perfect. Now look at the one on the right. See how that flat line between the P wave and that big QRS spike is stretched out? If you count the squares here, it's about 6 little squares, or 0.24 seconds. Our server's definitely being slow. This is a classic picture of a first-degree AV block.
Okay, let's wrap this up with a quick recap. Here are the 4 things you absolutely have to remember. 1. The P wave is the electrical start of the story, the atria getting the signal to squeeze. 2. The PR segment is that silent but critical intentional delay at the AV node. 3. The PR interval measures that whole journey, and it should be between 0.12 and 0.20 seconds. And 4. The whole point of the delay is to let the ventricles fill up with blood for a powerful, efficient heartbeat.
All right, time to check your understanding. Quick quiz. Question 1. The physiological event represented by the P wave is atrial depolarization. Yep, the atria getting the signal. Question 2. A PR interval of 0.28 seconds indicates an AV block. That's our slow server for sure. And the clinical case? An ECG shows a P wave for every QRS, but the PR interval is consistently 6 small squares long. The most likely diagnosis is first-degree AV block. You got this.
So our customer has placed their order. The server has waited patiently. The kitchen is fully prepped and ready to go. The server finally sends the signal through, and what happens next is the most powerful electrical event in the entire heartbeat. It creates the most dramatic shape on the whole ECG. What is that big spike all about? Well, join me in our next explainer where we dive into the roar of the ventricles, the QRS complex. And I promise, what it reveals is gonna surprise you.